Now, I know everyone in this room may not have a uterus, but I do know that they all know someone that does, whether it be your mom, sister, friend, or girlfriend. Today, I'm going to be informing you about the different methods and uses for birth control. I myself have experienced multiple different forms of birth control, and I will be sharing with you my experiences as well. I'm going to start by explaining multiple reasons why women get on birth control, and then I will list to you the different methods of birth control. And lastly, I will explain to you the common side effects. I hope that by sharing this information with you, you will be able to understand and or help someone else make the right decision in the future. Birth control is defined as the practice of preventing unwanted pregnancy, especially by use of contraception. Given this, many people assume that birth control is only used for preventing pregnancy. However, this is not the case. According to an article named Birth Control Benefits Beyond Pregnancy Prevention by Kesha Gaither, she stated that many women get on birth control to regulate their menstrual cycles and to prevent more pain. Following preventing pregnancies, this is the number one reason on why women get on birth control. Casey Guerin wrote an article named 28 Reasons Why People Get on Birth Control. In this, she simply explains why birth control is not solely used for preventing pregnancies. Some of her reasonings were that the wonders it works for hormonal acne or hormonal migraines. She also included the fact that being on birth control can help reduce the risks of ovarian cysts and ovarian cancers. In some states, including Kansas, underage girls are able to go and get birth control at little to no cost and without the consent of their parents. This is nice for teenage girls who believe that being on birth control can benefit their body, but their parents do not. Some of the most common forms of birth controls are IUDs, implants, shots, pills, and patches. I'm going to begin by sharing with you the effectiveness and stats of each one. I found all of my information in the Health Statistics article from the CDC and an article named Birth Control Methods and Types from PlannedParenthood.org. I'm going to begin by explaining to you the most common method, which is birth control pills and patches. Birth control pills are the most common form of birth control that is used. Approximately 19% of women that are on birth control use the pill. Less than 4% of people are on the patch. Although this is the most common form of birth control, this is also the most tedious. Not only do you have to remember to take a pill every day, you have to remember to take the pill at the same time every day, which can be kind of hard if you're the slightest bit forgetful. The patch lasts normally about 1 month, and then you have to make another doctor's appointment to get a new prescription for a new patch. Both of these methods are 91% effective. The next method I'm going to go over is the birth control shot. This is the shot that I began on, and I was on for 3 years. The shot is 94% effective, and you only have to go in once every 3 months to get the shot, and then you don't have to worry at all until your next appointment 3 months later. This is so much easier than trying to remember to take that tiny pill at the same time every day. However, less than 4% of women on birth control use this method due to the fact that this form has a higher set of side effects and they typically don't go away like the rest of them. This is the reason why I decided to get off of the shot. Next, I'm going to be going over the birth control implants and IUDs. 16% of women use these methods. The difference between an IUD and an implant is an IUD gets inserted into the cervix and works from there, but the disadvantage is there's not really a way for you to properly check up on your birth control at home without having to go to the doctor. The implant is a approximately 2-inch long stick-like device that gets implanted into the bicep area of your arm. The advantage of this is you can physically feel the implant in there, so you can make sure it's not broken and you can make sure it hasn't moved. Although the implant is more effective due to you can know where it's at, but the IUD, it's less of a chance of getting lost or getting broken. Although these have a very high success rate and their failure rate is less than 1%, along with the high success rate comes high health risks. This form of method has the highest health risk than rest of the birth control methods. When it comes to side effects of birth control, it is just like every other form of medication. There's a whole list of side effects and things that could go wrong, and could happen at different levels of extremities, or you could be the person that experiences none of those. They just have to tell you those just in case. According to PlannedParenthood.com, the most common side effects of birth control is weight gain and mood changes, but they were unsure to include that approximately 2 to 3 months after getting the initial dosage of the birth control, the side effects tend to wear away as your body adjusts to the hormones. There are some very rare possibilities that can happen when using birth control. These typically are around 1%, but the doctors still have to inform you of them. Some things that can happen are, if you are on any other medications, sometimes they can interfere and counteract the birth control. That is why it is important to make sure you tell your doctor what medications you are taking prior to getting onto the birth control. If a woman has the IUD or an implant, there's a risk that the IUD can become broken or can become unattached to the body and can start to flow and move around all throughout the body. This can be extremely dangerous to the woman's health, as it is only meant to be in the certain spot they put it in and not anywhere else in the body. Although I know it sounds very scary, doctors have routine checkups to make sure everything's running smoothly and to make sure you're in your best health. Although not everyone is very knowledgeable about birth control, I hope that by sharing this information, you will be able to help any female in your life or any person, including yourself, when choosing your birth control. I've shown not only the different types of birth control, but the benefits and the different uses of the birth control. So now that you ladies and gentlemen know plenty about birth control, you will be able to either properly choose or help somebody else choose the right decision in the future.